Hello, Dr. Abbas, Medical Director of the Bariatric Program at Memorial Hospital. One of the very commonest questions that I get asked is about vitamins, especially post-operative vitamins. So here I have Miss Jenny, who is our bariatric dietitian, and she is going to inform you about all you need to know about vitamins post-operatively. So Jenny, what would you say is, obviously, as we mentioned, the commonest question is, what kind of vitamins or how many vitamins a patient should be taking?
Absolutely. So depending on your procedure, you are going to need extra vitamins, and that's really to prevent any deficiencies. With any kind of bariatric procedure, you're going to have a change to your digestive tract, whether to your stomach or just to your stomach and your small intestines. So that is going to require additional vitamins in order to prevent any deficiencies. So depending on your procedure, during your education class, we will make recommendations for specific vitamins, including multivitamins, calcium, vitamin D and B12. We'll also add in additional iron and fat-soluble vitamins as needed. We'll also be checking your labs regularly as well after your surgery, just to make sure everything is looking good, there's no deficiencies that we missed, or we don't need to make any adjustments to your vitamins. So we will be talking a lot about vitamins and making sure that you do have a good vitamin option. Usually we'll recommend a bariatric brand, but we can always work with you to see what would work best for your lifestyle and for your regimen to make sure all of your needs are met.
That's great advice, Jenny, and I think that kind of summarizes it. The one thing I tell everybody is, for example, I do get asked 6 months afterwards, and as Jenny said, we do check your labs to make sure you're not deficient in any specific vitamins that we might need to address, is what kind of brands we should use. We will tell you, you should probably bring your vitamins in so we can have a look at the back of the vitamin and the labels and see how much actually of each ingredients are there. Generally, they all have very similar, I think, ingredients, but as you said, the bariatric ones are specifically geared towards bariatric patients, so they have a little bit higher concentrations. Any final thoughts with regards to vitamins specifically? I'm going to be having a lot more podcasts with Jenny to inform you more about the nutritional and the dietary aspects of before, during your procedure, or the immediate short-term procedure, and also afterwards. Any final advice on vitamins specifically, Jenny?
Yeah, absolutely. Yeah, main things we really hone in on are types of vitamins, making sure to avoid gummies. They have a lot of additional sugar. We usually don't recommend patches just due to absorption, and then we'll usually have you start out with a chewable or liquid and eventually switch to a swallowable as needed. So we'll be talking about all of that during your education class, and obviously be following up before and after the surgery.
Okay, well, thank you very much, Jenny, and we hope to see you next time.